This virus is not SARS, it's not MERS, and it's not influenza. It is a unique virus with unique characteristics. Both COVID-19 and influenza cause respiratory disease and spread the same way, via small droplets of fluid from the nose and mouth of someone who is sick. However, there are some important differences between COVID-19 and influenza. First, COVID-19 does not transmit as efficiently as influenza from the data we have so far. With influenza, people who are infected but not yet sick are major drivers of transmission, which does not appear to be the case for COVID-19. Evidence from China is that only 1% of reported cases do not have symptoms, and most of those cases develop symptoms within 2 days. The second major difference is that COVID-19 causes more severe disease than seasonal influenza. While many people globally have built up immunity to seasonal flu strains, COVID-19 is a new virus to which no one has immunity. Globally, about 3.4% of reported COVID-19 cases have died. By comparison, seasonal flu generally kills far fewer than 1% of those infected. Third, we have vaccines and therapeutics for seasonal flu. But at the moment, there is no vaccine and no specific treatment for COVID-19. However, clinical trials of therapeutics are now being done, and more than 20 vaccines are in development. And fourth, we don't even talk about containment for seasonal flu. It's just not possible. But it's possible for COVID-19. We don't do contact tracing for seasonal flu, but countries should do it for COVID-19 because it will prevent infections and save lives, and containment is possible. But we're concerned that countries' abilities to respond are being compromised by the severe and increasing disruption to the global supply of personal protective equipment caused by rising demand, hoarding, and misuse. Shortages are leaving doctors, nurses, and other frontline health workers dangerously ill-equipped to care for COVID-19 patients due to limited access to supplies such as gloves, medical masks, respirators, goggles, face shields, gowns, and aprons. We can't stop COVID-19 without protecting our health workers. Prices of surgical masks have increased sixfold, and 95 respirators have more than tripled, and gowns cost twice as much. We're also working with governments, manufacturers, and the pandemic supply chain network to boost production and secure supplies for critically affected and at-risk countries. Globally, it's estimated that PPE supplies need to be increased by 40%. We continue to call on manufacturers to urgently increase production to meet this demand and guarantee supplies.